In this video, we're going to be discussing different ways that you can track your menstrual cycle, whether you are just curious where you are within your menstrual cycle, maybe you're trying to do family planning, or maybe you're trying to conceive. Welcome to the Mama Stay Fit YouTube channel. My name is Gina. I'm a birth doula, perinatal fitness trainer, and mom of 3.
And I'm Roxanne. I'm a labor and delivery nurse, student midwife, and also mom of 3.
And we're going to be discussing different ways that you can track your cycle, whether you're just curious what is going on with your menstrual cycle. Maybe you're doing some family planning as if you're trying to prevent a pregnancy, or maybe you're trying to get pregnant, and understanding where you are within your cycle can be very beneficial. So first, let's start. What are the different parts of your menstrual cycle?
So there are 4 main phases of our menstrual cycle, and menstruation is like the beginning of every cycle. But the menstrual cycle, like that menstruation portion where you're actually bleeding for 3 to 7 days, is part of a different phase, which is the follicular phase. So this is the first phase of our menstrual cycle, and starts at the beginning of your menstrual cycle and lasts for between 13 to 14 days, and it ends when ovulation happens. With the menstrual cycle, it's important to note that these day ranges is just on average. What is the average for just like women in general in the world? Everybody's cycle length can be different. So I have a pretty consistent 28-day cycle, but Gina does not have a 28-day cycle. I think hers is 30-something days. And we're sisters, so we're pretty similar, but every one of us are individual people. I've even seen somebody have a 50-day cycle. So it's just really important to understand your own menstrual cycle and how long your phases last for you. This can be really helpful for one, preventing a pregnancy, planning a pregnancy, and understanding when conception happens for due date purposes. So within the follicular phase, this is when your egg is maturing to be released, as well as your uterine lining thickening to be able to hold on to and nourish an egg that implants there. The next phase is obviously ovulation. So ovulation is when our egg is released from our ovary and then starts traveling down the fallopian tube. Which ovary it happens to, it kind of just depends on our bodies and just the egg maturation, which egg is the most mature at that time. Sometimes you'll get eggs from the same ovary a couple months in a row. It doesn't alternate ovaries, which is kind of mind-blowing and kind of cool. But with ovulation, it's this small window of when ovulation happens that you can actually conceive. So ovulation itself only takes 1 or 2 days, where the egg is traveling down the fallopian tube. But conception happens usually within those 2 days or 1 to 2 days that egg is traveling. But you do not need to have intercourse and have the sperm during that time frame for conception to happen. If you have had sex a couple days prior, the sperm is still waiting in there for an egg to potentially be there. So you can technically conceive still, even though you did not necessarily have the act at that exact time. And same with afterwards, you could have ovulated and done the deed afterwards and still conceive. But with ovulation, we're looking for certain signs that ovulation happened. And these are the ways that we're going to be tracking our cycle. So one is we're looking for something called Spinbarky, which is this cervical mucus. It's very egg white consistency. So you put it between your fingers and pull it apart. It almost looks like you glued your fingers together, spider web type consistency. Or it just looks like you have this clump of egg white in your underwear. This is a really good sign of ovulation. The other one will be our basal body temperature. Our basal body temperature will increase at ovulation. So if you are tracking your basal temperature, which is taking your temperature with a special thermometer the first thing every morning before you move, then if you are really good about doing that, this is a really great way to learn when ovulation happens, because that basal body is going to increase. There are other ways, if you are like me and Gina, where you are not going to remember to take your temperature first thing in the morning, there are other tools out there to track your basal body temperature. So I think Gina has used a couple of them.
So for basal body temperature, I had tried just the thermometer. Failed. It would fall off the counter or my end table. I can never find it. or I would forget to use it because you have to use it before you get out of bed. It has to be like the very first thing that you do because once you start moving, your basal body temperature increases. So I also tried the wearables. So like the Ava watch was one that I used. And that was like a really great thing to do because you just had to charge it before you went to bed. You'd put it on. You have to remember to put it on. So that's the big thing. A lot of this stuff is just remembering to do. So that was like a really good way for me to track it because it was just a wearable that I can do. Something else that I was using was a Whoop watch, but I was actually having a hard time figuring out where the basal body temperature was to track it, but it did track it and it would let me know when it was a little bit elevated. But I found that Ava Watch's features within the app was more specific to like basal body temperature, so I preferred that over the Whoop watch for tracking that. Another tool that I've been using to help me better understand my cycle beyond just the basal body temperature is I've been using the Inito hormone tracker. And so every morning I pee into this tiny cup and then it's almost like a pregnancy test that you dip into it. And then there's a sensor that you attach to your phone and it like measures the level of hormones within your urine, which is like really cool. And it's this really cool like little graph that it creates. So there are 4 hormones that the Inito tracker is looking at. It's looking at estrogen, my LH, my progesterone, and FSH.
So LH is luteinizing hormone and FSH is follicle stimulating hormone.
Thank you. I only know the acronyms for those. But it's going to look at like how these different hormone levels fluctuate throughout my cycle. And so it lets me know when I'm in like my higher fertility phase because my estrogen is usually really high to let them know that I'm probably about to ovulate. And then it'll see like my LH has risen and then that drops to let me know ovulation has happened. And then it gets confirmed by an increase in progesterone. And so it's really cool that it's tracking all of these throughout my cycle. And now you have an option to only use the test during like certain parts of your cycle once you get a better idea of like when you're ovulating to like kind of confirm it. So you don't have to use it like all 28 days or all 30 days of your cycle. But I like to use it for every day just because I had a baby like 15 months ago or however many months ago it was. And so my cycle is still kind of regulating. Like some months there's like 40 days. Some months are like 28 days. And so because my cycle is still a little irregular, I want to make sure that I know what is going on with my cycle, especially as we were like getting ready to try to conceive again, to know, okay, this is when ovulation is going to happen. But also, like, I don't want to conceive for like another 3 months. So like, this is what is happening. So don't touch me.
Yes.
Because I still am trying to take care of a baby.
Yeah.
So I have found the Inito app to be like a really cool thing for me to gather more information about my cycle, to make sure that I am actually ovulating, to know like when I'm ovulating and then have it confirmed with that rise in progesterone is really cool. Because I found like the LH ovulation strips to be like really confusing because it's like, there's always 2 lines, but you're looking for them to be like the same intensity to confirm ovulation.
It's not like a pregnancy test.
Yeah, so it's really confusing. I had a really hard time with those, but that could be a much cheaper way to like confirm that you're ovulating. So you got the basal body temperature, you got the LH strips, and then we have the Inito app, which is like another really cool thing. I find that's just like much easier for me to know because it's even measuring how much there is, which is like really cool. So that's what I'm using right now to help track my cycle, and it's been super helpful for me. I also use cervical mucus. That's like another big one.
Cervical mucus, I feel like, is my go-to. But along with cervical mucus, another way we can track our cycle of when ovulation happens is our cervical position. So, like, you gotta use your fingers and reach up in your vagina to see where in the like vaginal vault your cervix is located. Is it like really high or is it really low? So during ovulation, our cervix will rise and get higher. So the cervix will rise so that the sperm doesn't have to travel as far. So that decreases the distance that they have to travel to get to the eggs, because sperm are not they are not the best at endurance. They don't want to travel far.
And so when you say that the cervix is sitting higher, you mean that it's thinner and there's just less cervix for the sperm to travel through?
Yes. Yeah. It's just higher.
Yeah. The other thing that I've noticed whenever I'm ovulated is my cervix is more open.
Yes.
As well. So when I'm feeling for my cervix, I'm feeling its position, the consistency of it, so it's a little bit softer, and then also it's a lot more open. And then in combination with all of this like egg white mucus, I know that I'm probably ovulating. Ish.
Yeah.
Around. So those are definitely like super helpful ways for me to figure out where I am within my cycle.
Within your cycle. Because like your vaginal discharge especially is like such a great tool, because outside of that ovulation, it's more like a watery consistency. And then ovulation, it's really thicky and sticky because it's like trying to get the sperm to stick and get there. Just trying to keep it in there. But the last phase of the menstrual cycle is the luteal phase. So this is the phase after the egg has been released. The corpus luteum forms, and the corpus luteum is a very important portion of pregnancy because this is what is producing progesterone. So progesterone is really important for pregnancy and like prolonging pregnancy and carrying to term. And that corpus luteum is the beginning part of this progesterone production. So it's going to release progesterone once that egg releases until it either implants into the wall, and then it's going to continue releasing progesterone until that placenta kind of develops. And then the corpus luteum will die afterwards, after that placenta is like there. Or if the egg doesn't implant into the wall, the corpus luteum will just die, and then you'll have a decrease in progesterone. So that is one of the reasons understanding the menstrual cycle is really helpful to track your own cycle, but also understand the effects of birth control pills, because birth control pills are either estrogen only, progesterone only, or a combination of estrogen and progesterone. So that's why some people will do really well on estrogen only, progesterone only, or have to use combination because of the way hormones affect every one of us differently. Some people are more progesterone sensitive and some people are more estrogen sensitive. So like knowing that you have different options available to you within those birth controls, if that's what you're wanting, versus doing natural family planning to prevent or conceive. This is just a side note, not anything to do with tracking, but progesterone only birth control is the recommended option when you first have a baby if you want to start birth control immediately, because it won't affect your milk supply as much as estrogen in combination. That was just this little caveat that just came to my mind. So it's our YouTube channel. I can share if I want.
So there are a lot of different ways that we can track our menstrual cycle, whether it's just you're trying to gather more information about your menstrual cycle, you're doing family planning where you're trying to prevent a pregnancy or have a pregnancy. This is all just like really good information for you to better understand what is even going on with your body. The easiest one to identify is probably your period. Like bleeding is a very obvious sign that that's where you are within your cycle. I think that one's pretty clear. You're probably going to have a little bit more energy in the first half of your cycle all the way up to ovulation. With ovulation, there's a lot of different tools that we can do to figure out if that ovulation is happening. One, just taking a look at your cervical mucus. It's going to be more egg whitey consistency, very stretchy, very clear. You can also look at your cervical position. It's a little bit higher, softer, more open. You can use different tools like basal body temperature to know that there's a change happening within your cycle, where you can use a thermometer or you can use a wearable device. We can do different devices to help measure how much hormones you have going on, such as LH strips, which is going to be the cheapest option, but maybe the least clear option. I think they do have some digital ones as well, which are probably a little bit more expensive. Or you can use an app like Inito, which is going to help track the actual level of hormones that you have within different phases of your cycle so that you know like that ovulation is happening, that ovulation is confirmed with that rise in progesterone as well.
So just to recap with the menstrual cycle, it has 4 different phases. The menstrual cycle and the follicular phase are kind of the same one. The follicular phase starts at menstruation and lasts for between 13 to 14 days, but could be longer depending on you as a person. It ends with ovulation, which is the next phase. Ovulation lasts for between 16 to 32 hours, just depending on you as a person and how long your egg lasts. And then it ends with the luteal phase with that rise in progesterone, and then either ends with a pregnancy or your period starts and you start back over at the beginning.
And then during the luteal phase, you tend to have a little bit lower energy as well. So that can also help you gauge where you are within your cycle. So if you want to learn more from us, feel free to join our online courses. We offer childbirth education courses, postpartum education courses, and then we also offer fitness programs, both online and in person if you're local to us here in Aberdeen, North Carolina. We offer prenatal fitness programs, postpartum fitness programs, and beyond postpartum fitness programs. If you're kind of outside of that first 6 months postpartum, you've done a rehab program, and you're ready to just continue to work out with us because people really like our programming. I think it's pretty good. I do have my master's, so I know what I'm doing. So you can check out all of our courses on our website at mamastayfit.com. If you want to specifically check out fitness programs, mamastayfit.com/fitness-programs is where all of our programs are, both for pregnancy, postpartum, and beyond.
And you can use code YouTube10 for 10% off any of our courses or programs for watching this video.
If you enjoy this video, be sure to subscribe to our channel so you get notified whenever we release new videos. We try to release 1 to 2 new videos a week, and we'll release several new breakdown videos of different exercises that you can do both during your pregnancy and your postpartum every week on our YouTube page. Be sure to like this video and comment below if there's anything else you want us to break down and to discuss related to the perinatal timeframe.